Hello, my name is Dr. Robert Arnone. I'm an upper cervical spine doctor and I practice in St. Charles, Missouri. And I'm here to talk with you today a little bit about post-concussion syndrome and chronic traumatic encephalopathy, or CTE for short. And these things have become more widespread or more known from the movie Concussion. And obviously it's in the news pretty much every day. We hear more about it from football. But people really have problems from car accidents, slips in the shower or bathroom, accidents at work, whiplash injury, you name it, other sports besides just football. So there's a lot of reasons this can happen, but basically what I'm here to set out to do from this talk is to explain to you that if you have a concussion and you go to get checked out, they're going to look in your eyes, they're going to have you track with your eyes, they're going to ask you questions, they're going to ask for symptoms. They're going to basically put that all together and end up with a diagnosis of concussion, which ends up with likely go home and shut the lights and rest a lot, maybe some pills for headaches, but basically it's, rest for a few days and it should do better. Okay, so the problem is there's an actual injury that takes place and it's not being addressed under this method of looking at someone who's had a head and neck injury. And so what happens is this. The mechanism of injury is that the upper cervical spine gets misaligned or locked into what we call vertebral subluxation, where the bones get locked in misalignment. So here, I'm going to explain this quickly with a picture. So here we have the back of the head, okay, and the top of the neck. Opening is nice and big and wide for brain stem to sit through comfortably. By the way, your brain stem, which sits down in this area, is what's responsible for your brain being able to function. It must send continual impulses up to the brain in order for your brain to function correctly. It cannot function correctly if it doesn't have that source, if it's not being fed from the brain stem consistently. And we're talking nerve flow, blood flow, oxygen, cerebrospinal fluid flow. That all comes from this brain stem and upper cervical spine. That's got to get up there. And also, this is where the injury happens. So what happens is, if you look at this opening, we see it's nice and wide open for brainstem, just like the top picture here. We have a concussion. We have, let's just say it's football, for example. We hit our head. We fall down. We catch a ball, fall down, hit the back of our head. This gets misaligned. Pressure there on that brainstem, like picture number 2 on the bottom here. That was never checked when we went to the hospital, when they looked in your eyes, or they had you track, or they asked you questions. They might have even gone as far as taking an MRI picture of the brain. They're looking at the brain proper. They're not looking at brain stem, spinal cord, top of the neck, cervical spine, where it makes sense that the injury would happen. The head is about 10 pounds. The little bone that holds it up is about 2 ounces. It's not a good ratio. It commonly gets misaligned. It might only be off by a couple of millimeters or so, but it makes a big difference to that person. It alters, like we said, oxygen to the brain, nerve flow, blood flow, cerebrospinal fluid flow, but not only to the brain, but it's got to wash out. It's got to come down through. The blockage does not allow it in or out properly. And as a result, we have brain function that's thrown off. And on top of that, there's usually some sort of symptoms. Sometimes it's headaches, sometimes it's dizziness, balance problems, depression, many different problems that can occur along with that. And so the purpose of this video is to tell you that it happens here. I'm telling you, more times than not, this is where it is. I've seen it over and over and over and over and over and over again. This needs to be fixed properly. So what I want you to know and take from this is there is hope. There is possibility for doing better. When this is left in the wrong position over time, we accumulate more and more and more destruction. And that's where it becomes chronic, and that's that CTE. that chronic traumatic encephalopathy, problems in the brain, traumas to the brain over time, but it's actually happening at the top of the neck. We can fix that. Not only can you improve from post-concussion syndrome, but you likely can avoid or at least severely diminish the chances of it turning into CTE. We don't want you to have depression. We don't want you to have dementia. We don't want you to kill yourself. There's a better way than that. It doesn't need just drugs and resting. Unfortunately, that's what most people do, but that's not the answer. There is a better way. Reach out to me and we can talk more about it. All right? There is hope. Hang in there. Take care.